Hi. I just want to share with you the excitement in related to a curriculum that for me as a physical therapist turned out to be a point of curiosity, a point of how do I help a person perhaps do better in their movement patterns for function. And that curriculum is called Visceral Manipulation. And as a manual therapist, functional physical therapist, one that works with orthopedic care and sports medicine, and evaluating the movement assessment, it was like opening eyes to see that I'm not just going to be in the musculoskeletal system anymore, that there's actually another curriculum that how we can help somebody look at the whole person and 3D. So you were almost looking from the front to the back or the back to the front in regards to what is in between the back muscles that give so much problems to people and the weaker abdominal muscles as to perhaps what the contents are underneath that abdominal weakness. So there is a phenomenal program developed by Jean-Pierre Barral in regards to looking at the organs and their suspensory system, how they attach in the human body, and perhaps their positions, their functionality, the attachments, and how they relate to the actual movement patterns that are in a person's body. So we excite you as an individual that may not have heard of visceral manipulation, and we invite you to come in. Perhaps it's curiosity, perhaps it's the results that you hear about that could be asking you to look up and read about this curriculum and then eventually talk to other people, look at some of the videotapes that are there, look at the before and look at the after changes in someone's body when you add visceral manipulation to a protocol, to your orthopedic tests, to see the difference as you look at the wholeness of a person and through them and how it affects the body and movement.